So today I'm going to guide you through emotional freedom technique procedures. I'm going to keep this as quick as possible with just a little bit of background and a little bit of addressing the procedure. Gary Craig created this many years ago. I took his training probably 20, 25 years ago, really as a student, but also had a fascination. It was before I had decided to become a psychotherapist. To some degree, it probably influenced that, but I had debilitating anxiety in ways that were just unbearable at times. And so I used this technique to help myself. I would say there were aspects that actually probably cured some underlying things. By and large, I used it to help tamp down the anxieties. I would often not use the full procedure. If it was 2 o'clock in the morning and I woke up in a panic, I might just start tapping on some places, typically for me under the eye and right here. The collarbone is probably the number one place I go to for my anxietying about things. If I just want to bring it down, sometimes I can bring an 8 down to a 5 just by doing this right here within just a couple of minutes. So different people have different needs, but I'm going to walk you through this. But I do want to give credit to Gary Craig. He actually created this. I think in 2010, he decided in his retirement to just open source it. So he put it out there. And so if you go online, you're going to see a lot of people who are not giving him credit. And that's pretty distasteful to me, including a site that I actually refer people to sometimes. They've done a great job of marketing. They've done a great job of coming up with an application that's pretty much based on his work. I think they do take some liberties, and that's okay. I leave that to them. But I don't know that they give him the credit. I haven't seen it. But that is the tappingsolution.com. I've had some clients that really appreciate that app. And so there is a cost, if there can be a cost to that, but not necessarily. There's a lot of free resources. So, but we're just going to do a kind of a crash and burn. This is really for people I've already trained, but we're going to do a crash and burn on this thing. So step number 1, hydrate. Before you even start this process, we're going to hydrate. So drink a little bit of water or some other beverage of your choice, certainly not alcohol because that dehydrates, but we're going to hydrate a little bit. Number 2, we're going to choose a specific area of concern. Now, the purpose of this procedure is to help reduce an undesired emotion, a triggered emotion of some kind. Typically, anxiety is probably the number one. Some variation of anxiety, fear, panic, worry, right? And then number 2 emotion that is most often treated is probably sadness, some form of sadness. Anger can also be treated through this, some variation of anger. So we think of the 4 core emotions: mad, sad, glad, and scared. So it can work with any of the 3 emotions that are not fully aligned for us, okay? So, but typically anxieties and then sadness is the secondary one that I see that people tend to treat with this. So it can be anywhere on the SUDS scale. So SUDS is subjective units of distress. 0 is I'm calm, cool, I'm relaxed. It's all gravy, baby, feeling good. Life is all right. And 10 is the worst state we could be in relationship to the topic. If we're at a 10, it's probably close to like hospitalization time, right? Like 10 is like it's as bad as it gets. So, but it is subjective. And so an 8 for me might be a 4 for you, right? Different people have different pain tolerances. And so here we are, the subjective units of distress. So before we get to that though, we're going to look at what is the core issue that is bothering me. So we're going to look at 2 aspects of this, the emotion and the trigger. The emotion we've already been talking about. So let's imagine the emotion is anxiety. So all of this anxiety about what? What's triggering the anxiety? Well, this is interesting because we don't always know what's triggering the emotion. But if we have an idea, then we want to include that here. All this anxiety about having to get up and give the speech in front of my class. All this worry about asking this girl or this guy out that I want to go out with. All of this panic and dread about having to go on this family trip. Um, uh, all of this claustrophobia that I'm feeling about being confined in a plane, right? And so we want to look at that core emotion and we want to see if we can identify the trigger. It might be all this fear and worry, all this fear about a memory of something that happened. Could be an automobile accident that you were in. Maybe this image, this memory, this fear and anxiety, all of this terror even can be an emotion. So we want to identify the emotion and in relationship to what. So a really good sentence is all of this terror or all of this panic or all of this anxiety that I feel when I pulled out in traffic and this car careened into me and the impact of the cars colliding. Now that's actually a rather complex sentence, but can be very powerful. We're activating a lot of events that are happening in that moment. And so it's a really good sentence to use for this, especially coming out of the gate. So now that we've got a sentence, we're going to plug that in. We're going to scale that 0 to 10. Right now, when I remember that, when I think about that, what's my subjective units of distress? 0 to 10. If it's at an 8, 9, 10, all right, let's go with it. No matter where the number is, we're still going to treat it the exact same way, but we're going to identify it and we're going to write it down. We have written down the problem. We didn't just think it in our head. We wrote it down very specifically. I'm going to take a side note and say how important this is because a lot of people, number one, never practice this. So good job if you're practicing it. Give yourself a high five. Number two, people do not tend to write these things down. Somehow we think we have these great memories, but we do not have the best memories. And when it comes to this work, it slides, it moves. Imagine an automobile accident. There can be 10 different trauma points related to the automobile accident. With this work, it's so important to be specific and clear about what we're treating because we might actually be getting some resolution on a specific topic and the brain starts sliding or slipping to other topics, you see. And they may be adjacent, but it may not be the bullseye of what we were treating. And I've seen this happen time and time again. So, very important to write down the very specific trigger to the emotional outcome. All right, so we've got that, and then we've written the score down, 0 to 10. So we've written the problem, we've written this emotional intensity. Now it's time to start with some treatment. The first thing we're going to do is something called Cook's hookup. I'm going to read it to make sure I get it just right. Sometimes we can just do this. This is not even a part of the tapping, the emotional freedom technique procedure, but I threw it in because I absolutely love it. I learned it from a different trauma energy therapy that I practiced. And so this is called Cook's hookup. His name was Cook, and this is his hookup. And so we're going to extend the right leg out, and we're going to extend our left leg out, and we're going to cross it over the right ankle. Okay, so our legs are going to be crossed, left leg over the right leg. Okay, good. Now we're going to extend both arms out with thumbs down, and we're going to cross the right hand over the left. Thumbs down, right hand over the left. We're going to clasp hands and lock fingers and then fold up towards the chest. So again, thumbs down, arms out, thumbs down, right hand over the left. We're going to bring the fingers together. We're going to clasp and we're going to tuck. And we're going to hold this for 90 seconds. So sometimes this can be a little uncomfortable for people depending on various things. So we can loosen it up if we need to. But usually we can hold that for a good 90 seconds. So again, one last time, thumbs down, right over left. Clasp the fingers and tuck. And we're just going to hold that for 90 seconds. I'm not going to do that now, but that's what I want you to do when you're practicing this. The other thing you're going to do is you're going to place the tip of your tongue on the roof of your mouth while you're doing this. So you're going to take the tip of your tongue. I don't need to show you this. And you're going to place it on the roof of your mouth the whole time you're doing this while taking slow, deep breaths for 90 seconds. So you'll have a clock in front of you. or something like that, where you'll know that you're doing this for 90 seconds and you'll have the tongue on the roof of the mouth. All right, perfect. So do that for 90 seconds. Then we're going to get into the sequence. Okay, so the sequence is very important. Each of these points represents meridian crossings. So I'm no expert in energy therapy in the sense that I understand how it all works, although I've studied much of it for years, but I haven't taken the deep dive into that. I understand some of the mechanisms of how we want to apply these things. So hopefully you've got your handout. Hopefully I've taken you through this procedure before, but what we're going to look at right now is called the setup. We're going to repeat 3 times with intention the setup. To do that, we're going to tap our karate chop point. This is the number one go-to that most people choose. There is also something called the sore spot. Now, Gary Craig stated that the sore spot actually tended to be more effective for psychological reversal. I'm not going to explain psychological reversal here, but that's really what we're treating by doing this procedure. So for me, I'm tapping on my sore spot. You know, different people, it's right around in here. Okay, so if you feel it and you're rubbing firmly, you'll find it because it smarts a little bit, right? So we're going to find that. I prefer the sore spot, but I'm going to teach it with the karate chop point because that's the one that most people are familiar with, and it's a little easier to access. So we're going to find that karate chop point. We're going to tap, 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 tap. Now I'm tapping firmly. I'm not just lightly tapping. We're tapping firmly. We're not going to bruise any body parts doing this, okay? We're not going to tap so hard we hurt ourselves, but we're going to tap firmly as we do this. Now, on the handout, it says 5 to 8 times. Sometimes the way that I do it, it ends up being a good bit more than that. I just tap the heck out of yourself. You're not going to hurt yourself, okay? Or don't hurt yourself, I should say. And then we're going to say out loud the statement. Even though I have this, whatever the problem is that I wrote down, okay, while we're tapping, if we're somewhere where we can't say it out loud, that's okay too. We can say it quietly in our heads, but we do want to say it with some level of intentionality. We're not just going through the procedures. This is not just something we're just going through the routine because James said we want to do this with intentionality and purpose and with an intention for healing. We're inviting the healing in. If you believe in a higher power, it's a good opportunity to ask for guidance and to ask for that higher power to have some influence in this process, okay? I'll leave that to you. So even though I have all this fear and anxiety about having pulled out in traffic and the car careening towards me and the impact of the cars colliding, that's the problem. I deeply and completely love and accept myself in my life. Even though I have all of this anxiety and fear and panic about pulling out in traffic and the car careening towards me and the impact of the cars colliding, I deeply and completely love and accept myself in my life. Even though I have all this fear, anxiety, I have all this panicky feeling about pulling out in traffic and the car careening towards me and the impact of the cars colliding, I deeply and completely love and accept myself and my life. Great. Now that is the setup. Now I prefer an alternative version that's a little bit longer. You can refer to the handout for that. I do prefer the longer version. But for the teaching today, we're going to do this. This is exactly how I was taught. I think I added a little bit to that, but that's a pretty good setup right there. We do it 3 times. Now, is it always necessary? It's not always necessary. Sometimes we can go straight into the tapping and have the same outcome. But because we're teaching broad strokes here, that setup, more times than not, is a fundamental. It's such an important crux of whether this procedure works or not. So being clear about what we're tapping on is pretty important. And if you have questions about that, we can spend an hour talking about why that's important. There's some specific reasons, but just knowing the procedure, following it, trusting that there's a lot of training. I've done this hundreds of times, probably thousands of times by now through the years. I've seen a lot of beautiful healing happen. And I've seen healing happen in people I never expected it to happen in. So you're no exception to that. I'll never say absolutely anything would help somebody because I don't know your unique brain chemistry and all the things that go into it. But I will say I've seen it happen many, many times where people had major breakthroughs, not always down to zero, but more often than not, we'll see that if people are persistent. So that's my invitation to you. Be very persistent with this. Okay. Now we're going to go through the tapping, and I'm just going to kind of show you where the tapping points are. All right. So we've identified, we've had some water, we've identified a problem or an issue, we have done the cook's hookup, and then we have gone through and we have done the setup for psychological reversals, which is what we just did. Now we're going to move into the sequence. So how we do the sequence is anytime, so even though I have all this, I deeply and completely love and accept myself in my life, then we move right into this issue, this problem. So I'm going to just say based off what I was doing a moment ago, this anxiety, this fear, top of the head, this anxiety, this fear, the eyebrow. Now on my list, I do top of the head at actually the bottom. Originally, he didn't train to do this part. So I actually put it at the first, but on the handout, you'll see it's at the bottom. But either way is fine. All this anxiety, worry, and fear, all this anxiety and worry about that automobile accident, all these terrifying memories. I can't sleep at night thinking about that accident. All this terrifying worry, fear, all of this anxiety, all this panic, all this feeling out of control, all this feeling out of control, all this anxiety. And we're going to go ahead and repeat that sequence. All this anxiety, worry, and fear. All this anxiety. All this anxiety about it. All this anxiety about it. Yeah, golly, it's such a scary thing to be in an automobile accident. The impact of the cars coming together. So terrifying. So I'm identifying these things as I'm tapping. Now the collarbone, well, you just got pictures of these things. So if you have questions, definitely don't hesitate to reach out to me. So that's one full round. Going through it twice equals one round. Now, full disclaimer, this is an abbreviated version. For years, I've always taught the full sequence, which includes some finger points. It includes some eye rolls and some different things, which can be very important. But I wanted to keep this pretty simple for this exercise because for 90% of the things, 85, 90% of the things, this sequence right here really does the job for people that practice it. So just know that. Now that we've done it twice, we're going to scale it again, 0 to 10. What's the current level of intensity? If I started off at an 8, has the intensity gone up? Has it gone down, or has it stayed about the same? And how do I know? Have there been any micro movements in one direction or the other? Almost always, just from breathing, there's going to be a little bit of movement, okay? So we just want to notice whatever we notice. We're not trying to force it to be anything. We're not trying to make it be something that it's not. But that's really important. So we're going to scale it again. Step number 6 on my handout is this next step, and that's going to be repeating the setup. So if the score's not at a 1 or a 0, and I have the time, then I want to go ahead and repeat the sequence again. In second and subsequent rounds, we change the language a little bit, okay? So even though I still have some of this remaining, so that phrase is very important, still have some of this remaining. Even though I still have some of this remaining anxiety and worry and fear about being in that automobile accident and the cars impacting each other violently, I deeply and completely love and accept myself in my life. Even though I still have some of this remaining fear and anxiety about the cars impacting and me being in that automobile accident, me causing it, I deeply and completely love and accept myself in my life. Even though I still have some of this remaining anxiety and panic about having been in that automobile accident and pulling out in front of that car and the car careening in towards me, and then the impact of the cars colliding. I deeply and completely love and accept myself in my life. This remaining anxiety. Now we're touching right here on the eyebrow, right? Either side's right there. Just right where the eyebrow starts. This remaining anxiety, side of the eye. So we're tapping right here, under the eye. I usually take 2 fingers and it's the one right under the pupil. Okay, a lot of times people get out here when they're tapping under the eye. This remaining anxiety, this remaining anxiety, this remaining anxiety, this remaining anxiety, worry and fear, this remaining anxiety, this remaining anxiety, this remaining anxiety. We're not doing the fingers, so let's start back up here. This remaining anxiety, this remaining anxiety, this remaining anxiety, all this remaining worry about that automobile accident. I think I did under the eye, but I can't remember now. All this remaining anxiety about the automobile accident. Now, sometimes when you're doing this, you're going to notice yourself taking a deep breath somewhere. For me, it's usually under the eye or here. Sometimes the chin will do it for me. It depends on, but 95% of the time, it's going to be under the eye right here. And I'm going to notice it, so I'm just going to hang out there for a moment while I'm tapping. And while I'm saying all this remaining anxiety, all this remaining fear. And I'm just going to be there. I'm going to hang out there. I might use my intuition to see how long to hang out there. Okay? And then we've done 2 rounds, that's or two sequences, and that equals 1 round. And so that's round 2. And then I check in again. What's my level 0 to 10 of intensity? If I started off at an 8 and then I went to a 5, what's my current level? Maybe it went back up to a 6, 6.5. So I'm going to write that number down. If I've got time, I'm going to do another round. I encourage it at a minimum 3 rounds per visit. If you can do 10 to 15 minutes a day, that's ideal. The most ideal is to sit down for a marathon and you just keep tapping until you're just bored out of your mind until that number gets down to a 1 or a 0. But sometimes it gets stuck at a specific number, and sometimes it doesn't seem to be going down anymore. And if you've done that 3 or 4 times and it just stays hovering at a 6 or 7 or 3, whatever number is, I want you to call me or text me so we can discuss options for this, okay? Because there are various reasons why that might be happening. What I would encourage you not to do is just give up on the whole process. So there are some nuances, but I can't teach all the nuances here. This is for the basic recipe, the basic sequence. You're doing a great job. Thank you so much for listening to this, for following this. This can be a game changer for people that have frozen traumas and frozen memories and are experiencing panic and anxiety, worry, doubt, and fear. So my pleasure. Give me a call, and I look forward to talking with you soon.